Hello and welcome to our video series. I'm Dr. Nancy Gill, and today I'm going to be talking to you about a sleep apnea device. So a lot of people will try the CPAP and find that they can't tolerate it, whether the mask doesn't fit or they can't sleep with it or it's bulky or they travel a lot, whatever it may be, not tolerable. But I do want to say that the CPAP is the gold standard. So if you can tolerate this CPAP, you're going to want to use the CPAP. So this is the alternative. It does need to be evaluated by a physician. So we work in conjunction with physicians since I'm a dentist, but we can fabricate these and it's pretty easy to do. I'm going to show you what one looks like just so you know. First, we would take impressions. So the first day you come in, we talk about it, we consult, we look at your sleep study and get the physician's approval for the device, and then we make impressions. We take a top and a bottom impression. The lab then fabricates this 3D model. So they scan it with digital scanning and then create a model that looks like this. The thing I love about that is that if by some chance something happens to your device, it doesn't take much to remake a top or a bottom appliance. So for instance, we had a patient and his dog accidentally got to the top. Unfortunate circumstance, a little bit pricey circumstance, but with just a phone call, I was able to remake his upper appliance and it was totally fine for him and really quick turnover. So we get these models. The appliance itself looks like this. This is the bottom. It has little fins on the side, and then this is the top. They look very, very similar. How we tell the difference is on this side, you'll notice really, really fine print. It says U0. That means upper 0. And then on this one, it says L0, and that means lower 0. The other thing I like about this particular device is that it is called lingualess. Lingual is for tongue, and that means that there's no material on the tongue. We talk a lot about tongue posture and tongue position and how important it is to have as much space in the mouth as possible for the tongue. And the last thing we want to do is put material by the tongue and not give the tongue any more space. So that's why we do that. If we were to put it in the mouth, this is the top here, just slides in like that. And then if it was on the bottom, it would slide in like this. And then if we put the two together, it would look like this. The other thing I like about this is that they're not connected. So you'll see you can talk with them. It's not going to be like I'm talking right now, but it's definitely understandable. So middle of the night, if you're a mom or a dad and your child wakes up and you need to say go back to bed, you can say go back to bed and it's just fine. So no worries there. The fins, if you notice that this is the top and the bottom, if the person lies back and the lower jaw wants to fall back because of gravity or maybe from clenching or grinding or whatever it may be, it can't. It just falls like this. And you can't physically get all that soft tissue clogged up in the back of the throat. It just physically can't happen. After months and months of wearing this, that soft tissue repairs. And we find that you actually don't need to be as far forward as maybe you were in the first month of wearing the appliance. So it also heals whatever soft tissue is back there. Snoring increases that soft tissue as well. It almost forms a vacuum suction in the back of the throat, and so it also will heal that soft tissue from any snoring that was taking place before. Patients do report that snoring either ceases completely or is considerably less or softer with wearing this device. If after 30 days of wearing this particular device, we do a screening for you or your physician does a sleep study for you, and we find that we've gotten better, but we still want to see if you can get maybe a little bit better than what we're at, then we're going to advance you 1 millimeter. And it's the same exact looking device, except for this one says L1. And we would just place that on the lower instead of the L0, still use the U0, and now we have 1 millimeter of advancement. We have an option to go all the way up to 3 millimeters. So basically, the addition of the top number and the bottom number equals the advancement in millimeters. So for example, if you look from the side, this is 1 millimeter. The jaw is just jutted a little bit forward 1 millimeter. Then we can go to U2 and L0. 2 plus 0 is 2. And so that's 2 millimeters. And then the next step would be U2 an L1, 2 plus 1 is 3, and that would be 3 millimeters. I can say in all honesty, I have no one at 3 millimeters. A lot of other devices, dentists are pushing them 7, 8 millimeters forward. The problem with that is it creates a lot of temporal mandibular joint problems. The nice thing about this is we're doing it in a neuromuscular position, meaning that instead of just jutting the jaw forward, we are actually allowing the jaw to come down and forward. So it's a rotational access versus just a sagittal pull. So by doing that, we find that soft tissue isn't in the way as much, and we don't have to titrate as far forward as some other devices. And so that's really nice too for our patients, because our success rate with decreasing TMJ problems and having TMJ problems because of wearing a sleep device is very, very low, and we resolve a lot of temporal mandibular joint problems with this device as well. So hopefully that answered some of your questions about wearing the device and what it looks like and what it does. If you have any other questions, you're always welcome to come in for a consult. And again, I'm Dr. Nancy Gill, and thank you for watching our series.